So Corey, when is your last day? Like the 20-something?
It is the 29th. The 29th.
Oh, a little bit longer then.
Yeah.
A little bit of a countdown going. I've been in so many schools this week and they have like the countdowns written on the boards.
Oh, well, I have a paper chain that's literally across from me that I have students that rip one off every day. So we're down to 15 school days.
I love the paper chains. That's when I used to teach, we always did a paper chain to count down to Christmas and to count down to the end of the year.
Yeah.
It's that visual aid. I think it just makes it feel like it goes faster.
Yes, absolutely.
Righty. Well, we are we are now at 1 o'clock, so we'll go ahead and jump in. Right. So welcome to the May School Health Lunch and Learn. If you guys see people throughout the meeting, please feel free to admit them. Great. So our topics today, this will be a shorter meeting than normal because we don't have quite as much to talk about. So I'll just give you some updates for my position. We're going to talk on measles briefly, and my supervisor, Erica Pitcher, is on the call as well. So if you have specific questions on measles, she's the Director of Clinical Services and Case Management. And then we have Shane on the call. He's from the school care team. So he is going to be talking about the great resources that the school care team offers to the schools in Allen County. All right. Sorry, I'm losing my mouse here. Okay. So again, like I said, it's a little bit shorter. We are going to talk about an optional data collection and survey I'll be sending out next week, that I would love it if everybody would be able to complete that for me. Sorry, guys, the lobby keeps popping up, so let me accept all of these people. Okay, so as always, if you would like a copy of the slides or any of the resources we talk about, please make sure you put your email in the chat. I don't send it out to everyone just because not everyone needs all these slides each time. So if you would like to get a copy of those, put it in the chat now. We will also be recording, or I am recording this, so I'll be posting it onto the YouTube channel, and then that shows you where to find it on our school outreach webpage. And you can also go back and watch any previous school lunch and learns all the way back through October. So as a reminder for anybody that's new, my name's Mary Corman. I am the school liaison and now also the health educator for the county. So the school liaison here, the role is to be a bridge between, we have nearly 160 schools in the county. So to connect all of our schools with the public health resources, not just what we offer, but also community partners. So like how Shane will be speaking about school care team, we want people to know of all the resources in the area and help you connect with them. So we are a primary point of contact for infectious disease surveillance in the schools. We have a number of online resources. So you'll see I keep reiterating that we do have a school outreach webpage. We have in-school programming, and then we also offer free trainings and certifications for both students and teachers. So if you're interested, or if you don't have a copy of our PDF, please let me know. So again, this is everything that's available on our webpage. So if you want to find the Public Health Student Heroes programming that we offer, they have a number of resources that they've made through the year. That program has wrapped up for this school year, but everything they've made is available, and we encourage schools to post what those students have made to share with other students. I did want to give an update. So I will actually be leaving this position as of May 30th. So it's a big change, but an exciting one. So I am your contact through the end of this month. And Erica Pitcher, who is my supervisor, and her contact information is there. She will be the contact just sort of in the interim. But we absolutely plan to hire another school liaison to pick up kind of the programming that I've built the last year and a half. So hopefully we will have somebody hired over the summer, and I'm going to try to make the transition as seamless as possible and give them everything they need to just sort of step into the role. So as of now, we are not going to be offering the summer trainings that we had talked about a few times. But the hope is everything training wise, the courses, CPR, stop the bleed, all of that should still be available next school year. It just might take us a little time to get the new person trained. So please reach out to me if you have specific questions on what that looks like. But hopefully there will be a new me next year to also lead these lunch and learns and pick the program up where I've left off. All right, so communicable disease update. I feel like measles is on everybody's mind, but we're going to go ahead and just do a recap, sort of big picture. So please make sure that you are using your IDOH communicable disease guide. The newest version is still that 2023. There is a link there. I'm happy to send you the link or the PDF. This just lets you know what to do in case you were to get an infectious disease outbreak in your school, or if you suspect you have something, this is a great resource guide to know what to look for. If you're unsure, you can always contact me and I can kind of direct you if you are not comfortable using this manual or if you're not sure on what your next steps would be. The 20% rule. So luckily, we're not seeing quite the spike in flu cases and COVID and things like that like we were a few months ago. But as always, if it's not a day preceding or following a holiday or like a long weekend, please make sure that if you have 20% of students out in a building or more, that you let us know. We want to investigate that to see if that is considered an outbreak. So you can send me an email, let me know, what your percentage is that's out for the day. And it's also helpful to know if anyone's been diagnosed or what symptoms you're seeing. So to know if it's a respiratory illness or a GI illness. And then if it is considered an outbreak, our infectious disease team will follow up with you after that. All right, so I made these, we give them out as magnets, but I'm happy to share them with you as PDFs. So we have it in English, Spanish, and Burmese, and this is based on guidance from the state health department. So it goes over what are the common symptoms of infectious diseases that would mean we should be keeping students home from school. I know this is easier said than done. A lot of parents will not necessarily follow this, but I'm happy to send this to you in any of those languages, and we encourage you to share that with families and really try to keep kids home if they're sick. All right, so on to measles. So as of April 11th, and this is still current as of today, we have had 8 confirmed measles cases in Indiana, primarily focused here in Allen County. So the team here has been very busy doing the follow-up investigations on that. Nothing has changed since we sent that letter out in April. So we just want to make sure that everyone on this call read that letter, had access to it. I also made a 1-page resource guide for you. So if you are uncomfortable answering questions or you're trying to field a lot of questions from parents, this is something that you can absolutely share. It is posted on the school outreach page if you want to download it, or I will attach it to the email at the end of this call. And overall, what you're looking for with measles is some of the symptoms come on that look like many other common illnesses. So the high fever is important. Usually it's over 101. Cough, runny nose, red watery eyes, but it's the spots in the mouth and the rash that are going to tell you more that this is indicative of measles. It's also important to note that measles rashes can look a little bit different depending on the skin tone. So it's important to be aware of that depending on your students. So again, keep an eye out for these symptoms. Our biggest point that we want to send home with you is if you suspect it's measles, please let us know. We would rather be informed and then have it not turn out to be measles than to have you wait until it's confirmed. So if you have a student showing these symptoms and you're suspicious at all, please give us a call. We can kind of walk you through next steps. If, again, you're suspicious of it, try to keep that child away from as many other students as possible and then get them sent home. Measles is highly contagious. It's about 90% of people who are susceptible to getting it will be infected if they're in the room with a case. And it can also linger in the air for up to 2 hours after the person leaves the room. So this is a highly infectious illness. That's why we take it so seriously. 1 case is considered an outbreak. The other aspect to really let parents know is if their child is unvaccinated, students are required to be excluded from school for 21 days after the last reported case. So this is where if you start to get multiple cases, a student may miss a significant amount of school. So you can see on the right-hand side there, it lists, oh, sorry, is my audio still working? My headphones are glitching a little bit. But those bullet points show you what we would consider someone who is able to come back to school. So whether or not it's that they've had their MMR, they have a laboratory test showing they have immunity, or that they have a titer drawn. please just keep those in mind. And Erica, I just saw you popped on your camera. Did you have anything you wanted to add on this?
Yes, I just wanted to add a couple things about measles to help you guys when you're fielding calls from parents. Um, we're always surprised at the number of people in our county that have a rash when something like this happens. So we're getting tons of calls every day with children that have fever and a rash. And so some really important things that you guys can kind of weed through when, if parents are calling in, if you're concerned about measles, um, they really are always going to have a high fever. And that's higher than 101. Some of our cases that we had 103 all the way up to 105. Um, the rash starts on the face and then spreads to the rest of their body from there. And then they really have to have some kind of risk. So yes, we did just have a cluster of cases here, but that cluster has closed. We closed out that incubation period, so no new cases will come from that particular cluster. So if you're concerned about measles, it's helpful to ask questions like, have you traveled recently? Have you been around anybody with similar symptoms who has maybe traveled? Because it's not something that we have naturally here typically on any given day. So looking for the fever, looking for that classic rash that starts on the face, and then asking those risk questions is very helpful. And then also we are getting a lot of kiddos that recently just got vaccinated and develop a rash, which you can develop a rash after you get the vaccine, and their doctor is testing them, and those measles PCR results will come back positive if you just got vaccinated. And so then parents are panicked because they'll see in a patient portal that their measles test is positive and they think their child has measles, which then results in them calling the school, and then the school panics and calls us. So that's another important question that you could ask too is, was your child recently vaccinated? Or if you guys have access to their CHIRP records, you could look that up yourself. And if they were recently vaccinated, that's likely explaining even a mild fever and a rash can follow a vaccine. So just a couple of helpful things that we've learned over the last couple of weeks, given the seriously hundreds of people that have fever and rash right now in our school system. So I'm happy to answer any other questions that you guys might have about measles, if you have any.
All right. Does
Thank
anyone
you.
have any questions at this point? We're also going to take questions at the end.
Okay.
All right. So we'll keep moving, but Erica will be on the call at the end, so she'll be able to take more questions at that point as well. Okay, so next week I will be sending out a link to everyone who gets invited to these calls. This will be similar to the needs assessment that I sent out last year. It's just going to be a general and fairly quick, mostly multiple choice, end of year survey about the school liaison program. Again, with me leaving the position, I want to make sure that I really know what went well, what would you like changed, and what would you like to see added for next year. So I'll take all of that feedback and then hopefully put it into the plan for whoever will be taking over the role. There will also be some questions in there related to the Health First Indiana topics. So we collect data throughout the year, depending on the different programs that we run. But I also want to get some information from you. So I'd like to know which schools have certain programs, what resources, what emergency medications do you stock? So there will be kind of two sections here. My goal is to make it as fast as possible for you because I know you have a lot going on this time of year. But I would greatly, greatly appreciate it if you could get that submitted before the end of your school year. So again, I'm almost done with putting all the questions together. It should be out to you next week. And it doesn't matter if one person from the school submits it or if multiple people submit it. I'll be filtering it by school name. So either way works for us. This is just a resource I wanted to share. And again, feel free to take a picture of it or screenshot it. These are just some free meals that are giving out over the summer. So if you know you have families that are going to struggle with meals, I know there's a number of programs that are student specific, but these are just community wide. So if you know a family that might struggle with getting food over the summer, there's quite a few places that will be giving out meals. All right, and now we are on to Shane Presley. He is the Senior Program Director at School Care Team, and this is a wonderful organization. He and I sit on a couple of different task forces together. So I just wanted to give him a platform to share what the school care team does. So Shane, when you're ready, I'll go ahead and stop sharing my screen.
Okay, thank you, Mary. I
Yeah.
think I can attempt to do this.
Well, I tried to talk fast, so you've got some extra time.
Wonderful, because it seems like I'm gonna need it. Well, bear with me, everyone, as I figure out how do you share a PowerPoint on Microsoft Teams. Not even an option. I wonder if this will work. Mary,
Mhm.
can you see my
Yep.
PowerPoint?
Yep, I can. You're good.
Okay, lovely. So thank you for having me, everyone. My name is Shane Presley. As Mary stated, I am the Senior Program Director for the School Care Team, which is, we're located right here in the heart of Fort Wayne, but we actually travel all across the state providing evidence-based training and programming for schools and school districts and communities trying to work with parents. So I'm just going to provide a quick 10,000 foot overview. And if anyone has any questions, they're welcome to ask, and or I'll have my contact information at the end of the slideshow if that is something that is more appeasing to you. So Mary, I'm just going to rely on you that did the slide change?
Yep. Yep. I'll let you know
Okay,
if
we're good.
anything looks odd.
Okay. We're great then. So a little bit about the school care team. As mentioned, we are a 501c3 nonprofit organization, and our mission is really to work alongside schools to nurture cultures of care and support student well-being through responsive training and strategic coaching. And so that looks like a lot of things, but really we just try to come alongside schools and work as think partners and figure out how we can serve you, because we're really in the business of serving individuals, not selling products or services. So we just want to figure out, how does your unique school landscape work, and where are your pinch points or your barriers, and how can we come alongside you to help solve those things? So our vision is ultimately where we envision schools where connection and community and hope are the norm for everyone. And we know that student psychological safety is a big part of that. While a school could be safe from a physical standpoint, if a kiddo doesn't feel safe, they're not going to bring their best self to the school, and therefore they're not going to be in a prime place for learning. So we want to figure out, what does that look like for a student in a school, and how is that perceived, and how can we help bridge those gaps? And you can see some of our core values right there alongside the screen are belonging, optimism, excellence, innovation, and harmony. So really things that we're focused on both internally and externally with the services we provide. So a little bit about us. We are driven by neuroscience and really rooted in hope. And so we have large hope that schools want to do better and can do better, and students want to be in the best place they can to learn and be a contributing part of their school, which will allow them to be a contributing person to our society as they get older and exit school. So we started doing this work in 2017 under the umbrella of another organization, and branched out in 2020. And so we're coming up on our 5-year anniversary of doing this work. And so we really try to impact students, of course, with programming, but also teachers, parents, and even administrators district-wide, and providing community education workshops. So we really run the gamut, because we realize that students' biggest impact typically comes from their teachers and their parents. And if we are providing them with tools and skills to, whether it be emotionally regulate or be better aware of what's going on inside themselves, if they are going back into an environment that doesn't support or is uninformed on how to continue that work, then we know it's kind of all for naught. So we try to support teachers, administrators, parents, as well as students in getting ideas for how to work with themselves. So this is more information regarding that, and this is really how we view our stakeholders and what we're trying to do in the community. So at the heart of everything we do is the youth, because we know that they are the next wave of change makers and people that will be carrying on wonderful works that we all take part of. So we really try to pour into the youth and realize that one of the ways that we impact them is through our teachers and our parents, because they are the most influential people in their lives. And we know the number one protective factor for a young person is one trusted adult, whether that be a parent, a teacher, a coach. And so really we try to cast a wide net because we know that adults are really impactful and help guide and mentor these young people. So we try to impact them through teachings and trainings for teachers and parents. And so just like we meet students where they're at, which is in the schools, we try to do the same thing with parents. So we go into local organizations and provide staff training and professional development through their employer, because we know that they're there. And we also know that sometimes when we host community trainings that are free to parents, the parents who need it the most are often the ones who aren't showing up, and the parents that are showing up are supercharged awesome adults. So we try to bridge that gap by meeting them where they're at through their employers. Same idea with teachers is we impact them through conversations and vision meetings with administrators, and because we know that they've got the big picture in mind, and we try to impact at that level as well. And then ultimately, we try to shift towards state legislature that supports schools, and impact through local community, through community trainings, through partnerships. We really just want to serve and help as many people as we can, realizing that that trickle down will inevitably be to the youth. So we are funded by the Division of Mental Health and Addiction. And so a lot of our services are grant funded or in part grant funded. So we typically, when we started doing this work, we served the 11 Northeast Indiana counties. And it's to the point now where 8 years later, we are across the top 2 tiers of the state. So essentially, if you split the state up into thirds, we serve the top 2/3. So we're really proud of our work and just the impact that we're making. And we're in 21 different counties across Indiana, and that's not counting schools or school districts. So the buildings and districts are a lot higher than those numbers. But as you can see, we go all across the state serving various schools of various sizes and settings, from what we see here in Fort Wayne to what we see in Northeast Indiana, those more rural schools. So we really just try to serve and help as many people as we can. And I think something we're really proud of is having programming in every FWCS high school this semester. I think that's been something that we're really proud of as an organization, because it's been a long time, and just having to chip away and provide what we can as we can. So we're continuing to grow, and this is just kind of the tip of the iceberg. And then just an overview of our program. So there are many that are not represented on this page, but I'll briefly go through these. So through our grant, a lot of the programming we provide is evidence-based, meaning it's gone through the rigorous studies to prove it's been effective. And so you can see many of those programs represented on the left side in yellow. So things that many of us are familiar with, like question, persuade, refer, or QPR. I even noticed catch my breath was something that is provided there. We also do catch my breath, but some of the things that we're really proud of are the wellness recovery action planning. We offer 2-day workshops, as well as do that in schools with the youth. That really is a time for us to focus on ourselves, our personal well-being, and what makes us well. And we have some community trainings coming up that anyone is welcome to attend at the Fullinger Foundation, as well as Electric Works in May and June, which, if you'd like to see more information about that, you can access that through my final slide. Erica's Lighthouse focuses on anxiety and depression. and provides a ton of free resources for individuals who are seeing a lot of those rates go up with our students. Komochi's is a elementary curriculum that really utilizes different characters and stories to help teach kiddos about emotional awareness, emotional regulation, and just general behavioral cues and how to relate amongst their classmates, and really focusing on building that social aspect and that emotional aspect for them. And then we have some more in-depth trainings like applied suicide intervention skills training, which I think of as like the next level to question, persuade, refer. It's a 2-day workshop where you're really learning how do you intervene in those crisis moments when someone may be experiencing thoughts of suicide. And then ideas such as restorative practices based on restorative justice, that idea of how do we reintegrate a kiddo back into the classroom when they've done something wrong, rather than expelling or suspending them, because we know the statistics surrounding that put them in much more risk when they're removed from their school setting. So the idea is, how do we get them back into this building and back among their classmates and kind of repairing the harm that they may have caused? And even sources of strength is something very popular, named on Vivek Murthy, who used to be the now it slipped from my mind, but he used to be under the Biden administration, and basically branded sources of strength as the #1 prevention program for a school-based setting when it comes to suicide prevention. And that's really focused on strengths rather than focusing on risk factors. What are the things that make people well and get well? And let's harness more of that type of energy. And then even something as far as Sapria, which focuses on sexual abuse, because we know that 1 in 4 women reported experience some type of sexual abuse or harassment. And so it is just something near and dear to our heart to be able to provide those individuals with resources, as well as education as to how you can receive help, or yeah, kind of mitigate any of those types of efforts from individuals. So those are a lot of our evidence-based programs that are approved. But that being said, sometimes schools, sometimes organizations are looking for something more specific that doesn't necessarily fit one of those. So we've developed curriculum based on best practices in the industry on different topics, such as building trust amongst teams, hope. How do we get hope? How do we build hope? And is hope actually measurable? Which surprisingly it is. And then how do we manage difficult conversations or bridge conversations in different perspectives? Because we know, just like any organization, schools have many differing perspectives of the employees that work there, and sometimes they can be pinch points. So how do we bridge those difficult conversations and find common ground? And then we have things pertaining to like burnout and stress, so owning your well-being, different regulation strategies. Brain and behavior is an overview of ACEs and what's happening in our brains at an anatomical level when different behaviors being exhibited. So it's giving our educators and our adults more kind of understanding of why a kiddo may be acting the way they are, because as we all know, behavior is a form of communication, and kids are not just inherently bad. There is a reason for their behavior. So it's trying to get to the heart of that and find out what's happening at that level. And then we've also developed ideas surrounding using levity or humor in the classroom, and how does it help increase belonging and have everyone kind of get a say at the table. So really, this is a super fast drinking water from a fire hose type of explanation, but I'm always happy to continue dialogue on any of these programs, or if something didn't necessarily fit your need, if there's something that we can provide. But this is an overview of some of what we do, and I wanted to be brief as well, Mary, so I limited it to just this information. So if anything I said seems like it would be of interest to you, this is a QR code. It takes you to a link tree, so you can find our website. We have a podcast called Envision. We also have a mental health minute video series on YouTube, free for anyone, that gives 90-second to 120-second lessons on things like boundaries, self-advocacy, effective communication. And they're really easy tools that we can use with kiddos or even adults. And that's all free to anyone. But you can find our YouTube channel through there, as well as upcoming workshops. As I mentioned, we have a few upcoming workshops of wellness recovery action planning coming up here in Allen County, and we would love anyone to join us, because we also do this with students. And why it's really beneficial is because we get to focus on our wellness, but we also get to focus on when we're not well and how do we make a plan to get ourselves back to our baseline of wellness. So I know many of us are in the caring profession, and oftentimes our needs come last. And so this is a time for us to really make that plan and focus on our own health and wellness, and how do we get back to that and we stay at that. So you're welcome to view any of that, scan that QR code, or if you would like to connect with me directly, my email is listed on the bottom left-hand side. But yeah, I just thank you, Mary, for inviting me to this meeting. I appreciate being able to share with you all. And thank you for all the amazing work that you do already. And if there's anything that we can assist with or help you in any capacity, please don't hesitate to reach out, because yeah, we love our students, we love young people, and we just want to serve whomever we can. So with that, I will conclude my speaking portion. So thank you, Mary.
Yeah, thank you, Shane. That was great. And I felt like I was very familiar with school care team, and I just learned something. So if you could please
Lovely.
email me those slides, Shane, and then I'll attach them to my follow-up email. So I
Great.
know we're at 1:30 now. Does anybody have any questions for me or Shane or Erica? She was on previously, elaborating a bit on measles. So you can type it in the chat, or you're welcome to just unmute and speak your mind if you have any questions. All right, so if we don't have questions, this will be my last lunch and learn with everybody. So I just want to say thank you so much for helping me really build the school liaison program up this year. So I'm going to work really hard to make sure it's a good transition, so you're still getting all of your needs met by whoever takes over for me. So we will go ahead and end there. If you don't have questions, or if you think of something later, please send me an email, and I will send that out, the follow-up, to anyone who put their email in the chat. So please make sure you add it to the chat if you'd like a copy. All right, thanks again, Shane. I really appreciate your time today.
Yep. Likewise. Take care.
Thank you.